My name is KatieVadasdi, and I'm one of the orthopedic surgeons at ONS, and I am a sports medicine specialist, and I'm going to be focusing on the pediatric knee. So why is it so important to talk about pediatric or adolescent sports injuries? We have over 30 million children participating in sports today, and we see 4 million sports injuries. Not all at ONS, some of those are spread out throughout the country. But that's between our college, high school, and other youth athletes. This is a significant increase in the last decade. And what we've seen is that a lot of these injuries, a big increase is in the overuse injuries. Overuse is considered excessive and repeated exercise that results in injuries to the bones, muscles, and tendons. 50% of high school and middle school injuries are overuse, and these are injuries that we can prevent and try to reduce with certain modifications in activity. The knee is the most common injury joint affected by overuse injuries. And I'm going to focus on 2 overuse injuries and 1 traumatic injury. The overuse are going to be anterior knee pain, which we see a lot of, and patella tendon injuries. And the traumatic injury I'm going to look at is ACL injuries. So to begin with, anterior knee pain. Anterior refers to the front of the knee. So when a patient presents with anterior knee pain, they have pain in the front of the knee, and this is commonly poor tracking of the kneecap or the patella in the groove at the end of the femur. It's common with overuse or training without enough stretching or strengthening. It's usually not an anatomic problem. For most patients, it's an imbalance of the muscles around the hips and the knees, and we can improve that with physical therapy, stretching, strengthening, and other preventative measures. For a very small population, it is anatomic and may require surgery, but that's a very small subset. So what causes anterior knee pain in the young athlete? It's an imbalance between the quads and the hamstrings. It may be a tight quad and hamstring. It can also be, and this is a part that's often sort of left out, is weakness of the hip abductors and external rotators. Those are the muscles on the side of our hips, and those help keep our hips and knees well aligned. It's often malalignment of the leg or maltracking of the patella, and is seen commonly in excessive training or, again, in an overuse situation. The symptoms are pretty common and clear. It's pain in the front of the knee, pain at night, pain going up and down stairs. Patients complain of down more than up. Pain sitting for an excessive period of time, running, jumping, squatting, and patients will often complain of cracking or popping, which can be kind of scary for a young athlete. The way to treat this, since most of these, again, are an imbalance, we want to first focus on getting rid of the inflammation in the knee, and then we want to focus on regaining that balance. So it's going to be anti-inflammatories, ice, rest, and then re-strengthening and rebalancing the muscles around the hips and the knees so that we can help allow that patella to track better. Here's a picture which I think is a bit exaggerated. If our knees really look like this, for the most part, it'd be very painful, but the picture on the left is a kneecap that you can see is sitting nicely in that groove. On the right, the patella is tilted and is off to the side a little bit. And that's where we see increased pressures across the front of the knee and pain. So we want to work with physical therapy, re-strengthening, to help get back to the picture on the left and improve patient symptoms. The second topic I'm going to talk about are patella tendon injuries. The patella tendon is the tendon that goes from your kneecap to your tibia, in the front of the knee as well. And there are 2 basic categories of patella tendon injuries. There's Osgood-Schlatter's, and then there's Patella Tendonitis. And Osgood-Schlatter's is seen in a younger patient with open growth plates. And it's inflammation of the tibial tubercle growth plate where the patella tendon attaches. Patients tend to be younger with an open growth plate, and they're going to present with tenderness, stiffness, and a lot of swelling over the front of the knee that you can see on this diagram right here. In a situation of patella tendonitis, it tends to be a slightly older, still child or adolescent, but they have a closed growth plate. So now they're going to have inflammation in the front of the knee over the patella tendon, not at the growth plate itself. They're going to have tenderness and stiffness as well, but they're not going to have that same amount of swelling over the tibial tubercle. And similar to the anterior knee pain, the way to treat this is first get rid of the inflammation through rest, anti-inflammatories rest, and then try to regain some of the balance of the muscles in the knee with physical therapy, working on strengthening and stretching the muscles around the hips and knees. Moving on to the third injury, pediatric injury, which is the ACL injury, and this is very common. This is traumatic. So the other 2 were overuse, and this is a traumatic injury. There are particular sports that are high risk, soccer, football. In sports where males and females both participate at a similar rate, we see 2.4 to 9.5 times risk in female athletes compared to males. And this is a huge opportunity for us to educate our young females, as well as our males, but to do preventative measures so that we can really reduce the risk of these injuries. The ACL is a ligament in the front of the knee. It's really right in the middle of the knee, and it helps balance the knee. And this is a video here that will just show you the ACL. And this is the ACL right here. And you can see as we go through flexion and extension that ACL is going to change in terms of how tight it is, but it's basically going to, and here's a cadaver looking again at that ACL in flexion and extension. The ACL prevents too much rotation on the knee, so it keeps your knee stable. In any sport that requires cutting, it's a really important ligament. It's going to prevent too much rotation. It's also going to prevent shear type injuries to the meniscus. The meniscus in return prevents injuries to the cartilage, and it's important for preventing early arthritis or injury to the joint cartilage. The ACL, if it fully ruptures, does not heal on its own. Here's a video which shows an example of a soccer player. She's going to plant, and you can see number 7, her right leg is going to go, and that's her ACL at that moment ruptures. Okay? I'm going to show you a couple diagrams so you can see why the ACL doesn't heal and why we can't go in and just repair it. Okay, so on the left here you can see a nice ACL, this nice solid black line, and you can see it down here on the pictures from surgery. And over here on the right, this is an ACL that has basically ruptured, and it really does somewhat explode. So the fibers really just sort of blow apart, and you can see down here all that's left is this stump, and there's nothing there that we can repair back down to the bone. And this video here will show that as well. And you can see these fibers are all that's left of that ACL. So we have to go in there when we surgically treat these and reconstruct that ACL. And this is a video we will take a tendon from somewhere else in the body and reconstruct that ACL. And that was, I'll show you again, a video of pulling in that new ligament. So the patient now, we're sort of restabilizing that knee. And here, final video, we'll take a probe and test that and make sure that we like that it's the appropriate tension on that graft and that we like the position as well. So ACL injuries, we see a lot of them, and obviously they have a significant impact on our athletes, both academically and in their sports careers. So we want to do everything we can to prevent them. This first slide, looking at shoe surface, protective bracing, and hormonal changes in female athletes, have not demonstrated any significant effect in reducing the risk. So the most important slide I can show you probably today for all 3 of these injuries is neuromuscular training. And what we want to do is do physical therapy to help work on strength, agility, and proprioception. It's going to work on balancing your quadriceps and your hamstrings, work on strengthening your hips as well, and really focus on jumping and landing biomechanics. On the left, the female athlete in the yellow shirt, when she lands, her knees go in. On the right, this athlete has been taught and spent time strengthening the muscle, so when she lands, her knee is directly over her ankle and it's not going in. That reduces her risk of ACL injuries, of anterior knee pain, of patella tendon injuries. And that's really going to be key for our young athletes to do this preventatively so that we don't see any of these 3 injuries in the office. So again, commonly we're seeing a lot of overuse injuries in our young athletes, particularly knee injuries, including anterior knee pain and patella tendon injuries. ACL rupture is more traumatic, but we can prevent it in a similar fashion with a similar program. Treatment for a lot of these is going to be rest, ice, anti-inflammatories, and again, that physical therapy component. And for this, prevention really is the key so that we can keep our athletes safe on the field and in the classroom so they can continue doing both and being a strong student athlete. Thank you.